Yeah, and so I guess it's one of the things that we don't think about so much. We often think about the physical side effects of being obese, so diabetes, cardiovascular disease, and some forms of cancer. We very rarely think about the emotional burden that people experience because of being overweight and the way that society reacts towards them. Society has a view of people who are obese that they're lazy and gluttonous, that they are a burden on society, and so a lot of the experiences that people have are related to those negative attitudes. We've heard in our research of people being spat at on the street, people being yelled abuse at, having the content of their supermarket trolley examined by strangers and so on. And so it's unsurprising that obese people are often the most isolated people in our community and sometimes have quite severe mental health consequences associated with that as well. Yeah, I mean, I think the stigma has always been there, but I think a lot of it has increased, particularly since we've started our war on obesity. So a lot of the anti-obesity rhetoric that's come out from a range of different sectors, the medical profession, from the media and so on. And so I guess what we've seen is that the perception of discrimination or perceived discrimination and stigma has certainly increased quite dramatically over the last 15 to 20 years. And people certainly report that. We did a study recently where 100% of people said that they had been overtly stigmatised because of being obese. So certainly it's getting worse. I think so. I think a lot of the stigma that people experience is because we basically put all our eggs in one basket with obesity. We tell everyone that it's your fault if you're fat, that if you're fat you've done the wrong thing, you've consumed too much, you haven't been active enough. And the way that the media and reality programs and sometimes our public health campaigns spins the solutions for obesity is that it's all about you being responsible as an individual, making sure that you don't eat too much, making sure that you exercise enough. And we know for the vast majority of people it's much more complicated than that. Yeah, I mean, obesity obviously is a health issue, and you know, I guess what we'd like to see is more and more money put into prevention and less money put into weight loss solutions, which we know are ineffective for the vast majority of people. And when we talk about prevention, we really need to think really broadly about the environments that we live in. So certainly we need to start to get away from that personal responsibility framework and learn the lessons from some of the other really successful areas of health, like tobacco. We didn't shame and stigmatise smokers, we shamed and stigmatised the industry. We need to start thinking about doing the same. It's a really great question. Well, we know that, you know, access to good health, or good health, is a fundamental human right. And one of the things that we've been looking at very closely is taking the emphasis off the individual all the time and starting to put some of the emphasis on what we call social responsibility. So that's industry making their products healthier, making sure that we don't have concentration of unhealthy products within some geographical location when people can't get access to healthy foods. And so really what we're asking is that we're asking government to think much more seriously about regulation and legislation to create environments in which people can be the healthiest that they can be. At the moment, many of our environments don't fit with the message that we're giving around health, and that's where we need government to step in. I think also there are some things about things like marketing, you know, the fact that children receive an enormous amount of marketing directed towards them around unhealthy food consumption, that a lot of those commercials and a lot of that marketing is completely hidden from parents. It's not just on primetime TV, it's through direct marketing, mobile phones, computers and so on, but even embedded within our sporting communities. And so again, we need to think a lot more closely about a community-based response to this, not just always blaming and shaming individuals. Yeah, absolutely, and certainly for me and the job that I do, it's around their marketing practices. So making sure, and this extends, it's not just one corporation, it's many corporations across the food and beverage industry, but also across our grocery industry as well. Today at the conference I was speaking a lot about the placement of unhealthy products so that they appeal to children. So, going around the supermarket, you see that a lot of the sweetest junk food is placed on the lower shelves because that's where kids' eye lines are, or unhealthy cereals. So again, it's starting to ask all of our food and beverage industries and the people who sell those products to be a lot more responsible with what they do.